would welcome all of you to this course on urogynecology by GIAN and Ministry of Education. I would now request our dignitaries to kindly grace the dais. Our chief guest, Afsha Khaja ma'am. We welcome you, ma'am. Our guest of honor, Professor Seema Hakim, ma'am. Respected Dean, sir, Faculty of Medicine, Professor Habib Raza, sir. Local Coordinator, GIAN, Professor Vibha Sharma, ma'am. Chairman, Department of Obstetrics and Gynecology, Professor Zehra Mohsin, ma'am. Course Coordinator, Shazia, ma'am. And we would also like to welcome a very special guest, Miss Zainab, who is Afsha ma'am's daughter. Thank you, Zainab, for joining us. GIAN is a global initiative of academic networks which was launched in 2015 by the Ministry of HRD. And today we are very honored to have Professor Afsha ma'am, who is an expert urogynecologist, to take this ahead with us. Dr. Afsha Khaja ma'am is an MBBS, FRCOG, PG certified medical education, consultant obstetrician and urogynecologist lead in University Hospital, Birmingham, UK. And she is an expert in surgical treatment for urogynecology and pelvic organ prolapse. We hope we have a deeper understanding of the subject with you, ma'am, and we are looking forward to further collaborations with you. I would now request Dr. Mehjami for the recitation from the Holy Quran.
Bismillahirrahmanirrahim. A'udhu billahi minash shaitanir rajim. Bismillahirrahmanirrahim. Ikra bismi rabbikal ladzi khalaq. Khalaqal insana min alaq. Ikra wa rabbukal akram. Alladzi allamal bil kalam. Innal insana ma lam ya'lam. Praise be to the God who created us. He created man from a clinging substance. He is the most generous. He taught man by the pen, and he taught man that which he knew not. Thank you.
I would now invite Professor Zehra Mohsin ma'am for her address.
Thank you so much, Mariam. Assalamu alaikum and a very good morning. Dignitaries on the dais, eminent faculty and dear students. Iqra bismi rabbikal ladzi khalaq. Recite, read in the name of your Lord. This institution was established with a vision of Sir Syed Ahmad Khan to acquire and to spread beneficent knowledge. We know there has been a great advancement in medicine, and the need of the hour is to develop super specialties. In this regard, we as a team, the department, is making small steps. We have developed ART, maternal and fetal medicine, and now we look forward to develop urogynecology. In India, roughly 25 to 40% women suffer from incontinence. The women we see are only the tip of the iceberg. It is a very, very embarrassing symptom, and lots of these women need help. Madam, Dr. Afsha, I'm very grateful to you for coming all the way from UK to help us gain knowledge, upgrade our skills, and to help these poor women. I'm also grateful to Professor Seema for her vision, for planning this program, and for sending the proposal for urogynecology. I am also very grateful to Shazia. Shazia has left no stone unturned in organizing this program, and I'm also grateful to each and entire faculty, the faculty members, the senior residents, the junior residents who have worked very hard to make this program successful. I again welcome you all, and I hope we have a very great program and learning sessions with you, madam. Thank you so much.
Thank you, Zara ma'am. I would now request Dr. Shazia ma'am, the course coordinator, for her address.
Respected Dean and CMS Faculty of Medicine, Professor Habib Raza sir, Chief Guest, Professor Afsha Khaja, Guest of Honor, Professor Seema Hakim ma'am, our dear Chairman, Professor Zehra Mohsin, and Local GIAN Coordinator, Professor Vibha Sharma. Assalamu alaikum and a very good morning to all of you. On the behalf of the Department of OBG, it is my proud privilege to extend a warm welcome to all of you. As we gather here together for the inaugural section of this program, Urogynecology in Understanding and Update, this course marks a significant milestone in our continuous pursuit of academic excellence and clinical advancement in the women's health. Regular gynecological evaluation in older women is an integral part of the medical care. This should be emphasized that symptoms associated with urogynecology are not life-threatening, but they impact the quality of life of the women. Urogynecology is a subspecialty, addresses some of the most intimate and often neglected health care issues like pelvic floor disorders, urinary incontinence, fecal incontinence, UTI, pelvic organ prolapse, and chronic pelvic pain. It is a must area needed to be developed in the country like ours. So today we are fortunate enough to have our renowned international faculty, Professor Afsha Khaja, a consultant obstetrician and gynecologist, serving as a urogynecologist at the University Hospitals, Birmingham, UK. Her commitment to share the knowledge across the border and fostering a spirit of collaboration has not only elevated quality of care, but also inspired us. She will be the key contributor with the extensive experience in the urogynecology. Another resource person, Professor J.B. Sharma, a nationally renowned expert from the Department of OBG, AIMS, New Delhi, with a special interest in urogynecology, will enhance our knowledge in the field. This 5-day program will serve as an excellent platform for the medical and paramedical professionals to update and enhance our knowledge on the urogynecology. With the experts in the field, this program will include lectures, tutorials, hands-on practices, case-based problems, and panel discussions. And I think it will be a very much benefited program for us. Thank you so much.
Thank you, Shazia ma'am, for the wonderful insight into the program. I would now request our local coordinator, Professor Vibha Sharma ma'am, for her address.
Assalamu alaikum. A very good morning to all of you. Respected Chief Guest, Professor Afshan Khaja, the foreign faculty for this program. Guest of honor for today's inaugural session, our very own Professor Seema Hakim. Dean, Professor Muhammad Habib Raza. Chairperson, Professor Zahra Mohsin. Dr. Shazia Parveen, the course coordinator. Senior faculty members, some of them are those whom I keep troubling. Dr. Shaheen, Dr. Manazir, I can see. Now Moinuddin Saab has also arrived. Dr. Jameel. So I know many of you. I welcome you to this inaugural session of GIAN program. Dear students who are in a good number present here, it's very heartening to see the enthusiasm for the inaugural session. I come from Department of English, so I'm a layman for whatever is going to, happen in the next 5 days. But all that I can do is underline the significance of this topic, like somebody from outside world, beyond the JNMC academic space, because as women, I know that gynecology is a word which comes in their life in countries like ours when women are expecting a child. And that is such a sad irony that it is often correlated that when you are going to deliver a child, when you are pregnant, then only you have to visit a gynec. And beyond that, it is nothing to do within your life. So much so that it is almost stigmatized to visit to a gynecologist for women who are not married or women who are old. So this is the level of ignorance. We have to start from somewhere, which I think this is a very important topic. From the concerns of some of my close family members, I know that it is even more embarrassing for an old lady in India to talk about visiting a gynecologist. It is something considered beyond her concern, beyond her health, that now that you are old and you have nothing to do with it except for some normal medicines for arthritis or BP and sugar. Medicines for gynecology or consultation for gynecology is not an old woman's world. So these are some of the stigmas that are very important, which I'm sharing with students out here, because as you grow and you move out in this world, you need to start from there by normalizing the discussion of issues around OB-GYN department and issues as something like any other health issue and not something very stigmatized or special or very private or personal. Because if you are having fever because rooted in UTI, does not mean that it's only fever. And 99% of women who suffer from UTI, they end up at doctor's place only when they suffer with high fever, not before that. So I think it's a very, very important topic. I'm very grateful to this department for choosing this area of studies and disseminating this general knowledge for the students, for us. I will seriously look forward to its proceedings because I have my personal interest now being a woman. I consider this that it is our right to know what is good and bad for us. To have general knowledge about our body and health is very important. It's part of education. Despite being educated, most of the women are not aware about their own body and its anatomy and its functioning and what care does it need time to time. So I must congratulate this department that they have chosen such a wonderful topic. It has been led by Professor Seema Hakim, a very experienced person, and all the senior faculty members. I could see the proposal and all of you are involved in that. That's very good. As a local GIAN coordinator, I must tell the students that this is a very important opportunity for you all and you must make the best of it. In a country like ours, which is considered to be a third world country, to have a fully funded research program for 5 days, a teaching course for 5 days, where you are inviting a foreign faculty, it's a very, very big thing that government is offering, because I know from my personal experience, I visit Scandinavian countries as a faculty member. visiting faculty member, and even there, you know, the funds are drying up for inviting foreign faculties in a fully funded program. So that our government is doing is very important. Please don't just let this opportunity go out of your hand. Make the best of it. It's very important that you attend each and every session and keep its document in your mind and spread the awareness as much as possible. I wish I could also see some of the external participants. Hopefully I'll meet them in the valedictory session, but I must tell them that we are very important, we are a front runner among the universities that are running GIAN courses. We have successfully done more than 25 courses by now, and many more are in pipeline. And to the young faculty members and senior faculty members, I must put this on record that please be ready with your proposals for the next season. Keep talking to your faculty members in foreign universities, because as soon as the applications will be available online, you should have good proposals to apply for. So that is going to happen very soon. So I'll welcome that, and I'll facilitate in all the senses that I can. And if you need any other help and counseling in the discussion of the proposals, please let me know. I'll be happy to do that, because I have educated myself to help my colleagues in the university so that we are able to apply at least 50 proposals, which is the maximum that a university can. So that's my target. I'll end up just by saying that it's a very big opportunity for all of us, and this is a wonderful topic. This is a very important area of social awareness, clinical awareness, health awareness related to half of the population of the world. All of you should participate in it, and thank you very much for giving me this opportunity to share my ignorance with you on this topic. Thank you very much.
Thank you, Vibha ma'am, for sharing your perspective as a woman and also for encouraging us to continue further the GIAN initiative. I would now request our Dean, Faculty of Medicine, Professor Habib Raza sir, who's also a patron for GIAN, to come to address the audience, sir.
Bismillahirrahmanirrahim. Assalamu alaikum. Good morning. Respected Chief Guest, Dr. Mrs. Afshan Khaja Sahiba, Guest of Honor, Professor Seema Hakim Madam, Senior Faculty Members sitting in the front row, the GIAN Coordinator, Chairperson, Professor Zahra Mohsin, and the Course Coordinator, and all other faculty members, students, ladies and gentlemen. This is a very important moment in the Faculty of Medicine, that we have an international faculty in our presence, and she is going to guide us to start a new course which I hope will take shape in the due course of time. And I congratulate Professor Seema Hakim for initiating that process, which is being carried forward by the other members of the department. First, I would like to thank the course coordinator for the global initiative of academic networks. It's a Government of India scheme and which brings the institutes of higher education face to face with the international faculty. And this is one such opportunity, and this is being done at the government level. And as she has already pointed out, that it is a very, very good opportunity for us. Since I have taken over charge as the Dean, I think this is the first GIAN course which is going to start from today. So I think they deserve a clap. In this context, I would like to add those all other chairpersons, all the faculty members sitting here, to initiate the process of applying for the GIAN initiative and send the portal is open, as I know, from this month itself, and I don't know for how long it will be available. So it has to be online, you have to apply, and then they will go through your project, and if they agree, I think the coordinator would be able to help you on that issue. So, but I want that at least 10-15 departments from our college should participate in this GIAN initiative, because of course, as she has already pointed out, a large amount of money is being given by the government of India. So we should be the first one to go and grab it, and for our students and for our faculty. If we leave this opportunity, all the time we are crying, there is no money, how to go about it. Now you have got an opportunity, you have got money also, but you have to prepare a project and submit it to the portal. And hopefully within 1 or 2 months you will get the reply, and then you can have this type of faculty from outside, and they will come and help you. And if you want to start a new course, if you want to give the students the best of the world, this is the best opportunity. You can have faculty from USA, you can have faculty from Canada, you can have from UK, any part of the world, the faculty can be available, and they will be, if they can come here, that's well and good. If not, you can have an online interaction with them. So this is a 5 days, 7-day course, the 15 days course, and it can be extended further also. So I think this is one of the best opportunities which is being given by the government of India, and if we miss the bus, then we are at a loss. So I request all chairpersons sitting here to prepare a project within a week and submit it to the GIAN portal, so that we can get other opportunities also. I welcome the foreign faculty to this great university. I don't know whether she has come before or not, and I think if she has come for the first time, and I see her daughter sitting in front with a smiling face, I will request them, the chairperson of the department, to take them around the university. It is a good opportunity for you, and you will find that there will be many things which you would love to see. So I request the chairperson to, in spite, other than the academics, you take her around the university, and she will have some good feedback when she goes back to the place. Regarding Professor Seema Hakim, the guest of honor, there is nothing which we want to add. She has been available to us. She has been working here day and night, and she has contributed a lot to the faculty. I appreciate her work, and I look forward for her coming again and again to this place and guiding her gynecological faculty, also the faculty of the university. Regarding urogynecology, I am a surgeon, so I know gynecology, of course, urology also I know, and this is a intermingling of the two subjects. We don't have that speciality in our department, in this faculty. But I would request the chairperson of the Department of Gynecology to take this thing from here forward, and at least start a subspecialty in your department with a specific OPD, and if surgical procedures are being done, of course it will take time. The 1 or 2 faculty members should be trained, and they can be sent outside the medical college to some other institute where this facility is available for training, and they come back and start this. It will be a very, very helpful project for the department and for the university. So I request, of course, after the training from the expert from outside, should not be for 7 days or 5 days. It should be a career which should be taken up by 1 or 2 residents or from the younger faculty members, and then they will take it forward, and it will be a separate department in due course of time. So with these few words, I thank everybody who have spared their valuable time, especially the senior faculty members, with these 2 things, that first you have to apply for GIAN portal, and for other departments also they should come with this initiative. And similarly, the gynecology department for starting this project and taking it forward. Just one couplet. सितारों से आगे जहां और भी है, अभी इश्क के इम्तिहान और भी है. So it is only the limit has been drawn, but सितारों से आगे भी जहां है. So it's not the final thing. You start and you take it forward. Thank you very much.
Thank you, sir, for your words of encouragement and for igniting the spark for further research and training. I would now request the heart of the department and our guest of honor, Professor Seema Hakim ma'am, to come here for her address.
Respected guests, esteemed faculty, and dear participants of the program, Assalamu alaikum and a very good morning. I am truly honored to be here today as guest of honor for this GIAN course on urogynecology, understanding and update. As stated by previous guests here, that this is a topic, this has a great contemporary significance. When I first suggested this course, it was because as a clinician, I have come across the challenges women in India face when it comes to getting care for urogynecological problem. Social stigma and financial difficulties often result in delay in diagnosis and treatment. This makes it even more important for healthcare professionals to have the latest knowledge and skills. This course has been carefully designed, bringing together some of the best experts in the field. I sincerely hope this platform encourages valuable discussion, enhances clinical knowledge, and improves patient care for many women who need it. Let us use this opportunity not only to update our knowledge, but also to remind ourselves of our commitment to women's health, ensuring that no women suffer in silence. I joined obstetrics and gynae department about 40 decades back. 4 decades, almost 40 years, 38 years, 39 years I stayed in this medical college, almost 40. So 4 decades back, and during my journey, I have witnessed significant progress in clinical procedure and improved patient outcome. However, much more needs to be done so that our department is also considered to be one of the best, not just nationally, but globally as well. To highlight this, I dedicate a few lines to all my obstetrics and gynecology colleagues who are sitting here, and I am so confident that they will prove it true. And these lines are, जिंदगी की असली उड़ान अभी बाकी है, जिंदगी के कई इम्तिहान अभी बाकी है, अभी तो नापी है मुट्ठी भर जमीन हमने, अभी तो सारा आसमान बाकी है. Dr. Habib Raza has said that we should develop this urogynecology and training is required. I am happy to say that we have been working on urogynecology and we are able to do most of the procedures which are difficult also. In some we take help of surgical colleagues also, but only a few procedures which we still like people need to be trained is birch corpus suspension, I think that is, and sling procedures for stress incontinence. These are the two things which needs training. Otherwise, most of the things which are in urogynecology, we are already doing it, and if need arises in department, I will always be there to help my junior colleagues in doing difficult surgeries also of urogynecology. Of course, with the permission of principal and dean, without that I will not be able to entering into the OT. And I guess Dr. Shazia is quite motivated and interested. She can go to AIMS for observership for 4 weeks, or even Afsha has agreed to call her and to give her further required training, and Afsha is doing many procedures which are not still popular in India, and I think by learning those procedures, by just practicing those procedures, we will be able to popularize them in India as well. So I would like to conclude my address with a thought that resonates deeply with me. A woman's happiness, ambitions and goal should never be hindered by her inability to access optimum health care. Because with the urinary problem, many women, they leave their job also because they are so stressed. So it becomes our responsibility and duty, being sitting in the premier institution, to take care of those women and make a center which should be one of the best in, at least in UP. Thank you all, and I look forward to enlightening sessions that awaits us.
Thank you, Seema ma'am, for always being there for us. We love you. I would now request Dr. Afsha ma'am, our chief guest, to address the audience.
Good morning, everyone. I'm so honored and humbled to be here today, and I'm so grateful for Dr. Seema for inviting me. And first of all, I'm very thankful to Professor Habib, Dr. Weba, all the senior faculty, and most important of all for today, or all the students. Good morning to all of you, and I really look forward to talk to you all over the next 5 days. So my name is Afshan Khaja, and I would like to show you few of the pictures. I know a picture says 1,000 words. So next slide, please. Yeah. मुझे इसे पॉइंटर बता दें, ये नेक्स्ट के लिए, नेक्स्ट के लिए, ठीक है. So just few pictures to show you, and then it just gives a little bit about my background, my family background. And it just helps us understand who we are and where we are going. So these are my affiliations. This is where I work. So the name of the organization is University Hospitals Birmingham. So there are 4 hospitals: Solihull Hospital, Heartland Hospital, Queen Elizabeth Hospital, and Good Hope Hospitals. So our jobs are divided into all these 4 different hospitals, and Royal College of Obstetrician and Gynecologist. I'm a fellow, and I'm an examiner for Part 3 MRCOG exam. So first of all, again, my immense gratitude to Professor Seema Hakim. Can you hear me on the back? Yeah? Is it better now? Yeah, maybe I'll be a bit closer. So after Dr. Seema, Dr. Shazia, who has been coordinating this course, and Samra. And I'm very grateful her. Yesterday, she took us to exhibition, and what an experience it was. It was the most colorful evening for us, and we absolutely loved it. It was an assault to the senses, but it was very, very delightful. So first of all, few words about past. Past is never ever gone. We are here because of past. But it will not tell us what to do, but we must learn from it what to avoid. That's the value of past. And also, we should never think past is dead. It's never dead, because it is there to teach us all the time. And if we value past, our present and future is going to be guarded. So this gives me so much honor to tell you that I was born on a little spot in northwest of Pakistan, just 3 miles on the place where I was born. This is the first university of the world. This is Texila. This is the first civilization, Gandhara civilization, and it is WHO World Heritage Site, and this is where my childhood is spent, playing in between these stones. So if you search it, Taxila, Gandhara civilization, World Heritage Site, and this is the area I come from. This is an important place in my childhood. This is called Sher Shah Park. It was built by, can you believe, Sher Shah Suri. So I live in a point of history which amazes me up to this point, that the first university of the world on one point, and the other side where I have played all my life is Sher Shah Park. This is a little well which was built for the horses of Sher Shah's caravan on their way, because he built Grand Trunk Road, and his horses will drink water in this well. So that is one spot which is famous in Wakent. So I have another claim to fame. This is Jahangir. So Jahangir was famous for his justice, but the reason I am showing his picture, can you believe the area I come from, it was named by Jahangir. How amazing is that? So the history goes, in 16th century, Jahangir was traveling from Afghanistan to Lahore, and in the night they decided to stay over and they made up tents. It was pitch dark. When he woke up in the morning and he came out of his tent, he was amazed with the beauty of the place. It was water streams, it was lush green gardens and fruit orchards. And he said, "Wah, wah, wah." And this is the place. The place was named from that day. So name of my city is Wah. So before that, this area was called Jalalsar. But since that day, the name of the place is Wakent. So where is this place? It's amazing, isn't it? You don't know about it. It is such an amazing place. So before I mention the map of that, why did I mention a daffodil here? Any relevance? So everybody is saying Iqbal's poetry, so I decided to take a reference to Iqbal's poetry. This is such an important moment for us to see a daffodil here, and I'll tell you why. हजारों साल नरगिस अपनी बेनूरी पे रोती है, बड़ी मुश्किल से होता है चमन में दीदावर पैदा. So when I was in primary school, you know, being in Pakistan, we must learn Iqbal's poetry. And I hated this. And I said, who is this Nargis and why is she crying? I never understood that why is Nargis crying and what is this Didavar? It was unbelievable how difficult was it to understand. But the day you grow up, you understand who is this Didavar. Who is Didavar? What do you think who is Didavar? It is someone who has vision. It is someone, because of that vision, the change of humanity course changes after their lifetime. Someone who changes humanity in a good way. So what could be the best example of Didavar? This is the best example of Didavar. And because of him, and I am so deeply humbled and honored to be here today in the city of Sir Syed Ahmad Khan, and he is a true Didavar. So, born and brought up in Wakent, which is northern Pakistan, it is a little place which is just 19 miles northwest of Islamabad. I graduated from Rawalpindi Medical University in 1997, and now you all can guess my age. So, I worked in Wakent and Saudi Arabia for a few years, and my wish was always in my childhood. I had 3 wishes. One was to visit Hawaii, which I have never done so far. Second wish was to eat a lot of strawberries, because we never had strawberries in Pakistan. And third wish was to go abroad and do post-graduation. So that wish has been fulfilled, and of course strawberries as well. So this is the little esteemed place from where I come. So this is map of our India and Pakistan. We are, where we are you can see, but you see how much northwest I come from. So we are very close to border of Kashmir and very close to Ayubia and Murray and all the mountains of Pakistan. It's a very cold place, but it is beautiful, and all of you, if you ever get a chance to go to Pakistan, you must visit Ayubia and Murray and Nathia Gali. These are my parents, my Ammi and Abu. This picture was taken in early 1980s. And the reason I show you, because of course they are my parents, but there is another reason which is relevant to India and Pakistan. What do you think what it could be? Samosa and pakode. So they are equally beloved snacks in Pakistan, most favorite all the time. So these are my friendship group. So being in Pakistan in a little cantonment area, we all to do cadet training. So it's a rainy day in my intermediate school, and these are my childhood friends. So there they are, my 4 children. This is 16 years old picture with little Zainab there as a baby. The reason I'm showing this picture, as parents, it's so challenging to bring up children. That is the greatest challenge even if you live abroad. It's really difficult. No post-graduation training or anything else could be more difficult to bring up than to bring up your children in the right way. So the reason I show this picture, when children are little, everything seems in control. And you think, yes, you know how to bring them up and you know how they are going to be. But what happens next? This is what happens next. So these are my children. Everything goes upside down when they grow up. And then you think, oh, those days were better when they were little because we could control them. But now they are out of control and they are upside down. This is my husband Zahir, and I have the honor of being 50% Indian and 50% Pakistani because my husband comes from India. So my husband comes from Hyderabad. He's here, not here in this hall because he was a bit sleepy this morning, but he is accompanying us. And this is my hobby. In hobby as well, there is a bit of obstetrics. So this is our hen Silky, and she had roosted her eggs in our garden. So we love that. And my another beautiful thing is my cat Kishmish. So most of my time I spend with my Kishmish rather than with Zainab. So that was my personal life and a little bit about my professional life. So I teach a lot to medical students in University Hospitals Birmingham, which is Birmingham Medical School. So this is the permanent lecture which I deliver to 3rd years. And then of course in addition to that, it is small group teaching. Why I have shown this picture, I don't think anyone would be able to recognize this. This is not a famous building like White House or Taj Mahal or anything else, but to me this is the gold standard. And you will be surprised why I'm showing this picture. This is a hernia repair hospital in Toronto. And why did I show it here? This is the hospital. The hospital does only one single operation, which is the abdominal hernia repairs with the native tissue repairs. And they are the hospital, they have the least complication rate and highest success rate in the world. They do only one single operation. They don't do anything else. And if someone wants excellence, this is where they need to go if somebody has abdominal hernia. So there is a message beside this. Why did I choose this picture? Because of this. What is excellence? We are that we repeatedly do. Excellence then is not an act but a habit. That was the take-home message for all the students sitting there. Toronto Hernia Repair Hospital teaches us that if we do something repeatedly, this is where the role of training comes from, and things can be learned. There is nothing in the world we can't learn, but what we need perseverance, we need knowledge, and we need training. And this is why we are all here, and hopefully we can achieve what we are training to achieve. Now the next question is, should urogynecologists do all the urogyne surgery, or it should be done by general obs and gynae consultants? But first question is, who is a urogynecologist? So definition is, it is a person who is trained in a unit which provides full range of urogynecology service. It's part of multidisciplinary service. 3 clinical sessions in urogynecology per week, which include theater, urogyne clinic, urodynamics, It's part of British Society of Urogynecology surgical audit participation and CME participation. So, surgery, the nice way, National Institute of Clinical Excellence, it leads the way in the UK for all the surgery. The service of urogynecology should be integrated, effective, and viable. The caseload should be sufficient, and everybody needs to audit what they do, which is British Society of Urogynecology database. It is the world's largest real-time ongoing database. So each and every surgery I perform or any other urogynecologists perform, they must enter data on this database. So this is the world's largest database. So I know exactly by click of a button how many autologous facial slings or incontinence surgeries I have done, because it's all real time. And it also, it has pre-op and post-op validated patients' outcome questionnaires. So I know exactly what's my success rate, what's my complication rate, and anybody can check that. Anybody can check all the performance indicators. And there is long-term follow-up in place, and it is part of an MDT. This is how the surgical database looks like. So in summary, we are what we repeatedly do. Then excellence is not an act, but a habit. So continence and prolapse surgery should be done by consultants who have sufficient caseload and who meet RCOG BSUG clinical standards. And main aim is to provide quality of care and good patients' outcome. So these are the three societies which we must be affiliated with, which is International Urogynecological Association, International Continence Society, and British Society of Urogynecology. So these are my trainees, one each from India, Pakistan, and Bangladesh. It's a beautiful picture. And this is just after a day out. So quite a few of our trainees are from India in this picture. And this is everything I owe to is Professor Robert Freeman in that corner and Mr. Luigi Bombieri. These are my teachers, and I've learned everything from them in southwest of England in 7 years run through training. And this is where I was trained. And urogynecology is not a one-man show, and it's not a one-stop clinic. It's part of MDT, part of the team, and it's ongoing care. And everybody needs to develop a team, only then urogynecology services can be provided. And this was my team when I finished my training, and this picture was taken in 2014. And this is where I was trained. It is Plymouth, which is southwest of England. Thank you very much, everyone. Thank you.
Thank you so much, ma'am, for taking us through your personal and your professional life. And we hope we continue learning from you. Last but not the least, we would extend our heartfelt thanks to Professor Naima Khatoon, who unfortunately, the Honorable Vice Chancellor of the University, who unfortunately could not be here with us due to some prior commitments. And I would now invite Shazia ma'am, the course coordinator, for the vote of thanks.
On the behalf of the Department of OBG, it is a great honor and privilege to deliver the vote of thanks to all of you. First of all, I would like to thank Allah, the Almighty, for this occasion to be held. My sincere thanks to Professor Naima ma'am, the VC of the AMU, though she is not here, but she has served as an impetus for the academic program and is a great asset to this institute. Thanks to Professor Muhammad Hafiz Brother Sir, Dean Faculty of Medicine, who spent his busiest time to grace this occasion. Today we have the opportunity to hear from you, sir, which have enlightened our minds. Sincere gratitude is extended to our international faculty, Professor Afsha Khaja, our chief guest, for saving her precious time by accepting our warm invitation in spite of numerous hassles. Thank you, ma'am, for being with us and enlightening us with your skillful knowledge. Seema ma'am, our beloved teacher and the guest of honor, you are the driving force behind this whole process. With deep sense of appreciation, I wish to thank you for your untiring efforts for the conduct of this course. We are also thankful to our national faculty, Professor J.B. Sharma, who will be sparing his valuable time in guiding and teaching us despite his busy schedule. We are fortunate enough to be supported by a very dynamic, motivated, and dedicated local coordinator, Professor Biba Sharma, ma'am. Your prompt assistant helps us a lot. I want to express my gratitude to our most hardworking, dedicated chairperson, Professor Zahra Mohsin, ma'am. Ma'am, you are always being there to help me out. Thank you very much. I also wish to thank the faculty members, Professor Tamkeen Khan, Professor Nishat ma'am, Professor Shaheen, Dr. Nazia, Dr. Dalia, Dr. Deeba, Dr. Roshan, Dr. Amna, Bushra and Mariam of our department for their indispensable help with their great interest. Special thanks to Zakia ma'am and Veena ma'am for sparing her valuable time to be being with us. A very special thank to Professor Nasreen Noor for her motivation and assistance throughout this course. Thanks to Professor Farhazmi, Principal Nursing College. Thanks are due to PRO of the university. I also wish to thank our senior residents, junior residents, and dear participants for cooperation and contribution. It will be unjust if I won't extend my thanks to Mr. Salman, Dr. Tabassum, and the staff members of the OBG department. Thanks to the Dean and Principal Office staff members. Finally, I would like to thank everybody who has contributed for the successful execution of this course. I express my apology if I could not mention personally one by name. Thank you once again, everybody.
Thank you, ma'am. We would now felicitate our dignitaries, and I would request Professor Nishat Akhtar, ma'am, to felicitate Professor Habib Raza, sir. सीमा मैम करेंगी अफशा मैम को. I would request Professor Seema Hakim ma'am to felicitate Dr. Afsha ma'am. Veena ma'am. Veena ma'am उधर है ब्लू में. Veena ma'am सीमा मैम को देंगे. I would request Professor Veena Maheshwari ma'am to felicitate our guest of honor, Seema Hakim ma'am. Shaheen ma'am. I would request Professor Shaheen ma'am to felicitate our chairman, Professor Zahra Mohsin ma'am. I would request Professor Nasreen Noor ma'am to felicitate Professor Vibha ma'am. And I would request Dr. Dalia ma'am to felicitate our course coordinator, Shazia ma'am. We have a special felicitation for Professor Zakia Arshad ma'am, who's been here as a stalwart, who's been here as a pioneer of urogynecology even before we were born. So we would request Shazia ma'am to felicitate Zakia ma'am.
कि भाई ये प्रॉब्लम फला डॉक्टर फेस कर रही है या पोस्ट ग्रेजुएट फेस कर रहा है ओटी में, मैं रूम में बैठी हूँ, मैं देर में जा रही हूँ, नॉट ऑलवेज, आई नो व्हेन टू डिले, देर में जा रही हूँ। कई बार मेरे इर्द गिर्द जो स्टूडेंट्स थे या कोई, उन्होंने ये कहा कि मैडम आप देर में क्यों जा रही हैं। मैंने कहा मैं जानती हूँ कि क्या हो सकता है आगे, इतना सीवियर प्रॉब्लम नहीं है, और लेट दैट सर्जन और द गर्ल स्ट्रगल on this surgery field for the solution herself. Let her struggle to find out the solution to that problem, and I will go to assist. So a few minutes at least was given by me for the student to struggle.
Now the term has come. Recently, ma'am, the term has come that facilitative supervision, which she has been doing for past so many years.
जो नाम दे दिया हम लोग का सब चलता ही था ये सब।
बहुत मैंने जो मैडम की जो चीज़ है जो सबसे ज़्यादा मुझे लगती है इम्पोर्टेंट है, जो मैंने मैडम से सीखा, बड़े से बड़ा कॉम्प्लिकेशन हो जाए, मैडम बहुत कूली आती थी, उसको देखती थी कहती थी अच्छा ये कॉम्प्लिकेशन हो गया, कोई बात, अगर कॉम्प्लिकेशन नहीं होगा तो सीखोगी मैनेज कैसे करना सीखोगी। So she gave us and made us who we are.
Thank you. But behind this teaching, who was there? My teacher, Dr. Mohini Malika Das. She was MS and FRCS, FRCOG rather, and she worked in England for a long time. She married a Britisher, but unfortunately she lost her husband, so she came back to her native place, Lucknow, a very good Christian family. She was my teacher when I was a house surgeon and later on. One day she was operating, it was a simple operation, tubectomy. And in our hospital, the anesthesia was primitive. Mask here and ether on it. And the patient was struggling. Abdomen was bulging, going back, bulging, and in that only many times all of us had to do surgery. So when she put the incision in the peritoneum, the small intestine was cut. As a student, I was very much afraid. But what she said, sister, give me this thread, catgut. See, she stitched this tear or the incision that was she made on the intestine and proceeded with the operation. And very quietly she said, never mind if you have created any complication, but you must know how to deal with it. So a few words of my experience to you. I hope I have not bored you. Thank you all.
Thank you so much, ma'am. We will now have the University Tarana. Followed by the national anthem.
अधिनायक जय हे भारत भाग्य विधाता। पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा। विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा। तव शुभ नामे जागे तव शुभ आशीष मांगे। गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता। जय हे जय हे जय हे जय 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 हे।
With this, I thank each one of you for sparing time out for us, and we would now proceed for high tea in the girls and boys common room. And we meet again at 3 p.m. in the nursing college for the further proceedings of this course. Thank you.